All right, we are live now. Good evening, everyone. Thank you for joining in for this webinar. Wherever you are joining us from, just let us know in the comment section. I am Eniola in therapy. I'm still here where I am Chingu, and together we are going to continue with Unmasking Childhood Depression webinar. But before we go into all of that, because this is going to be like a very, very interesting Q&A session, I want us all to just sit back and relax, even as I, properly introduce the speaker, right? Are we ready for that? So let me go ahead and introduce the speaker. Chinwe is a dedicated psychologist with extensive experience in working with children with special needs, proven expertise in conducting assessments, developing tailored intervention plans, and collaborating with families and educators. Committed to fostering a supportive and inclusive environment to enhance the well-being and development of each child. She strongly advocates for evidence-based practices and ongoing professional development in the field of child psychology. Hi, Chinwe, you're welcome. Can you just, let us know that you are here?
Hi, everyone. Good evening. It's good to be here. It's good to have you guys here too.
Yeah, that's Chinwe. Thank you so much for joining us for this fireside chat. So without further ado, we are going to just jump right into this session. And like I said, it's going to be a Q&A, so it's going to be very, very interactive. If you have questions, just drop them in the comment section. We'll definitely address them even as we go on. So, Chinwe, are you ready for the first question that I have for you today?
Yes, I am.
All right. So my first question here is, what exactly is childhood depression?
Okay. Childhood depression is obviously the mental health problem that needs medical assessment and treatment. But I'm going to broaden it for us to understand. So childhood depression is a mood disorder, right? It's a mood disorder that's characterized by sadness, worthlessness, helplessness, and low interest in activities generally. So yeah, childhood depression is a mood disorder.
All right, thank you for that. Thank you so much for that. I'm just going to move into our next question. The next question is, so yeah, you mentioned that it's like a mood kind of thing, but really want to understand what are the type of depressive disorders that can be found in children? Because we are considering children for today. So what are the types of depressive disorders that can be found in children?
Okay, thank you so much. I'm going to be talking about two depressive disorders that can be found in children. The first one is DMDD. That's an acronym for Disruptive Mood Dysregulation Disorder. I'm going to take that again. Disruptive Mood Dysregulation Disorder, DMDD. So that's one type of childhood depression. Now, what is DMDD? So many of us are not aware that childhood depression has this part. DMDD is just characterized by severe recurrent temper outbursts that are grossly out of proportion in intensity and duration to the situation. Okay, I'm going to explain that in case you do not understand. DMDD in the layman's knowledge is just overreactiveness, irritability, being overly irritated about something, and it can be very aggressive. Children tend to be very aggressive. Children with DMDD tend to be very aggressive and tends to be very irritable in situations. When the situation is not in tandem with the reaction, then the child has DMDD. And you cannot diagnose a child with DMDD unless the child is between the ages of 6 to 10. So therefore, if the child is below the age of 6, you cannot say the child has DMDD. And if the child is above the age of 10, you cannot say the child has DMDD. Also, the major feature of DMDD is a chronic irritability that is present in between episodes of anger or temper tantrums. Okay, and before you diagnose a child with DMDD, it has to occur in different settings. What does this mean? The child has to express this temper outburst both in the setting of the school in the setting amongst his peers and the setting of the house. If the child only performs or has this outburst in the house or at home, you cannot say the child has DMD. It has to be present in more than one setting, right? And the duration, it has to last for a long time. It has to last for 12 months, 3 times a week for 12 months. Now, people mistake children that are sad or lonely or just feel sad for a particular period of time to children that are depressed. No. It's a normal thing for a child to be sad over something that happened, yes. But when it is consistent, when it lingers, then you can have a concern and take that out to your healthcare practitioner for some assessment. So yeah, one type of depressive disorder in children is what we call DMDD. DMDD is just, you know how they tag children, this child is spoiled, or you say this child is too violent. People tag children a lot without actually understanding what exactly is wrong with the child. So DMDD is extreme irritability in children. When they have extreme temper outbursts, it can be very violent, it can be aggressive, and it's not in proportion to what is actually causing them to do this outburst. Maybe what happened or what has happened is very little, and the next thing you're seeing is that this child is all over the place, lifting things up, shouting unconsolably. The child is not even, you cannot console that child. So that's one. Then the other type of depressive disorder in children is what we call MDD. MDD is an acronym for major depressive disorder. I'll take it again. The second type of depressive disorder in children is called MDD. And MDD is major depressive disorder. I think this is the one we are mostly familiar with, right? Because when you hear depression, the next thing that comes to your mind is, oh, the person is always sad, the person is always moody, or the child is always sad, the child is always moody. So yeah, children also suffer from MDD, major depressive disorder. What is major depressive disorder? Major depressive disorder is characterized by the combination of feeling sad, feeling empty, feeling hopeless, and you have loss of interest or pleasure. And this has to last for the most of the day, nearly every day, for 2 weeks or more. There you have MDD. MDD in children can also be diagnosed from the ages of 6 through 10. Remember that before you diagnose a child, or before you say, oh, this child has depression, it has to be consistent. It has to linger from, let's say, 3 times a week through 12 months. It has to be consistent. You cannot just say, oh, because the child is feeling sad today and the next day you not say, oh, this child has depression. No, it has to linger for the whole 12 months. And when you notice something like that in your child, it is very important that you do not take matters into your hands. You take the child to healthcare practitioner. Thank you.
That. Okay, thank you very much for that answer. That was very, very enlightening. Another question I have here for you is, how is childhood depression different from blues? You know, there's this common thing, oh, it's just like a blue phase, person is going through blues and all of that. How is childhood depression different from that?
Okay, thank you very much, Eniola. I remember in our last session, we talked about postpartum depression and how postpartum depression also is different from the normal everyday blues women go through. So childhood depression is not the same thing as the normal blues children go through, right? Childhood depression is different from the everyday blues that most kids get as they develop. The fact that a child feels sad, the fact that a child feels lonely, the fact that a child is irritable does not necessarily mean that that child has childhood depression. Childhood depression is persistent sadness. I'll repeat that. Persistent sadness. It has to be persistent. It has to go on it has to go on and on and on and on and on without, you can't pacify the child. You try so many things to brighten the mood of that child, and it's not working. Now you have situations where children get sad over things they lose, over being punished. Yes, that's a normal blues of children. And they can just be sad, or probably they have a toy that got spoiled and they cry over it, they brood over it. It's a normal thing, but you cannot say because the child is brooding, but because the child is lonely and is sad at that particular time, you now diagnose or characterize the child as a depressed child. There are two different things. Childhood depression is persistent sadness, and when it occurs, the child feels alone. The child feels hopeless. Imagine a child feeling hopeless. You're wondering what the child is feeling hopeless about. The child that is just coming up. So a child is feeling hopeless, a child is feeling helpless, worthless. When this type of sadness is unending, right, and disrupts every part of the child's life, it interferes with the child's daily activities, it interferes with the child's schoolwork, it interferes with the child's relationship, right? You can now say that child is actually depressed. It affects the child daily, every day, it is persistent. Then you can say, oh yes, this is childhood depression, right? Childhood depression can also, okay, right. I hope I answered the question.
Oh yes, you did. Thank you very much. I still have more questions for you. All right, the next question I have to ask you here is that what are the signs and symptoms of childhood depression? I know that any mother or any parent that is watching this is really, really what they want to hear in this, webinar. Like, how do you know? How do you know that your child is actually going through depression? It's hard to believe. So how do you know? What are the signs and symptoms?
Okay, there are so many signs and symptoms, so many, and it's a pity because most of us in this part of the world, we take these signs and symptoms too, like, we don't take it serious. If your child is just acting up, oh, she's just acting, don't worry, she'll get over it. Don't mind her, she's just looking for attention. Please, let's not be like people that do not care. Okay, when your child is showing certain things, let us put our head down and actually observe. Observe your child. It's very important you observe your child. So, to answer that question, I'll say this. The symptoms of childhood depression vary. Okay, it depends on the child and their particular mood disorder. Many times, childhood depression goes undiagnosed and untreated, and this is because of we are not sensitized to know the signs and symptoms. Okay, sometimes we just pass it off as a normal emotional or psychological change that occurs during growth. Yes, children have stages in growth. We have so many stages. That's a whole different topic on its own. But because children have stages in growth, doesn't mean that when you see something that is off with your child, don't attribute it as, oh, that's a normal physical and psychological and emotional change that occurs with a child. Like I said earlier, it's very important as a parent to observe your child. It's very, very important. So having said that, one symptom of child or sign or symptom of childhood depression is extreme irritability. Extreme irritability or anger. Like I said with explaining what DMDD is, it's characterized by irritability. Yes, that's one sign. When you observe that your child is easily irritated, easily angered, and gives this outburst that is, the proportion is higher than what is actually causing the child to do the outburst, then you should take a look at that child and start observing that child. Don't just conclude that this child is a very naughty child, or this child is very stubborn, or this child is very this and that. You just stand down and observe. So one sign or symptom of childhood depression is irritability, extreme irritability, or anger. Another sign and symptom of childhood depression is feelings of worthlessness. Feelings of worthlessness. When you have a child that is always telling you, I am not good for nothing, I can't do this, I can never do that, and your child is always saying these things, feeling this way, comparing themselves to other children, you should take notes, you should observe that child. So another sign of childhood depression is feelings of worthlessness or guilt. They are endless. There's a lot, and I'm going to make sure that I talk about each and every one of them. Another sign or symptom of childhood depression is loss of interest in hobbies and other activities. You have a child growing up, and you know that this child loves playing in water, or this child likes swimming, or this child likes playing football. And gradually, the child is losing interest. You know your child, you know this thing, if this child does it, it makes him or her very happy. They feel they're on top of the world and all of that. And gradually this child loses interest and you do not care why. It should be a point of concern to you as a parent. When you see that this thing my child likes to do before, he doesn't like to do them anymore for no reasonable reason. It could be that somebody outside shamed him, or somebody somewhere said something mean to them, or somebody somewhere did something that you're not aware of. You have to ask your child questions. You have to ask, I'm going to come back to the questions you asked. You have to ask your child questions to figure out what exactly went wrong. When you see that your child is losing interest in almost everything, doesn't want to watch cartoons, she doesn't want to play with her dolls, she doesn't want to do anything, she's just there moody, lying down. Not, you should just observe your child. Another sign or symptom of childhood depression is change in appetite. Now, the child either has an increased or decreased appetite. When you see that happening in your child, just know that there's an issue to look into. Some children tend to become overweight. You see children that are overweight and you feel, oh, they're just spoiled, eating so much. They don't know how to control their appetite. They eat anything that they see. When a child eats excessively, especially when the child doesn't eat excessively before, you should know that there's a problem. You should know that it's a point of concern for you as a parent. Do not let people tag your child as your child is just overweight, she eats a lot. Try and make your child. There are other ways to handle things like this. When you notice that your child is going through things like this, don't let that child become a point of stigmatization, a point of how would I put it now? You will just tag the child as the child is spoiled, the child eats too much, the child is a glutton. Exactly. People just call those children gluttons, spoiled, sports-rich children. Without you, you don't know the underlying causes of what is making that child eat a lot. So one of the signs of depression in children is excessive eating, which will definitely lead to obesity or fatness, and also decreased appetite or decreased eating. Another sign is changes in sleep. Now, it's either the child sleeps too much. When I mean too much, 12, 15 hours in a day, the child spends most of their time sleeping. When the child sleeps too much, the child is barely interested in doing any other thing. So they use sleep as their escape route to just get off from their environment. So once your child is behaving like that, just know that there's an issue to look into. And when your child doesn't sleep well, I remember as a child, I suffered from neglect, right? And in a way, it affected my sleep. I remember not being able to sleep well in the night, tossing and turning on the bed, and no matter how much I close my eyes to sleep, it doesn't just come. As a child, it's not like the child is worrying or having to worry about what this person or that person will eat. No. But you just see yourself not being able to sleep. There's a problem. There is a problem. And for children to actually function the way they should, they need to sleep well. Another sign and symptom of childhood depression is increased sensitivity to rejection. Now, some of us have children here, and probably we've trained our children to sometimes accept the no, right? When you tell your child, you don't have to get everything you want all the time. Most children will understand that. But when you find out that this child, anytime there is a denial or rejection, the behavior of the child is altered extremely. The behavior of the child is extremely altered, and it's just different. The child doesn't know how to take a no for an answer. When you have such children around, you should put your head down and okay, I have to observe this child and I have to take it into consideration. There are a lot of signs and symptoms, and I'll still take more. So the next one is physical complaints. Children that always complain about their stomach, their head, and they don't respond to treatment. You go to the doctor will tell you the child is fine. Nothing is wrong with the child. I would explain that. Now, when children are depressed, they are exposed to what we call stressors. And like it is called, stressors. What do stressors do? They stress your system. So when those stressors are active in children, automatically they just make that child suffer from so many pain, stomach pain, head pain, this pain, that pain. I had a child when I was teaching. I had this child every morning. She complains of headaches. Every morning, she's always moody in the morning in school. Every morning, she complains of headache. Did you tell your mommy you had a headache? Yes, she did. Did you take medication? Yes, she did, but she still has headache. Now, when you notice that your child keeps on having repetitive headaches, and you know you're not putting that child under due distress, you're not putting that child under unnecessary stress. The child goes on their normal life as a child, go to school, come back, do your work, eat well, do this, and but the child is still having these things. You should have it at the back of your mind that you have to watch out. You have to observe that child and pay attention. Don't just ignore, don't neglect it. Anytime that child comes to me, sometimes I feel she's making it up. Even me, I've been a victim of not understanding up until later. I feel she's just making it up to get attention. But right now, as I'm thinking about it, I see, oh, this child probably was actually having something deeper than just wanting attention. So if your child is always complaining of stomach aches, unending stomach aches, unending headaches, it's a red signal for you to attend to. Don't ignore it. Don't say, oh, this child is looking for attention. No, don't do that, please. It is a red signal. Also, another sign of childhood depression is fatigue and low energy. The child is always tired. Junior, can you come and help me do this? No, mom, I'm tired. Okay, do you want to play? No, mom, I'm tired. I'm tired. I'm tired. I am tired. You know, children are always active. They are very active. The energy they have is times 10. I don't know how to put it, but children are known to be active. They are known to be full of life, full of energy. Okay? And when your child is showing you signs of fatigue, fatigue is not just tiredness. Fatigue is extreme tiredness. So when your child is giving you that I'm always tired vibe, she's giving you that low energy, not being enthusiastic to do anything, right? Is a point of concern for you as a parent. So I think I've exhausted most of I'll talk about two more. Another type of sign or symptom you should look out for in a child that is depressed is vocal outbursts or crying. This sign falls under the DMDD. It falls under the DMDD. If you're following through, you'd know what DMDD is. So vocal outbursts or crying, being irritable, being aggressive, any little discomfort, the child becomes shouts, screams, and all of that. I've worked with children with special needs, and it is very possible that a child with special needs can also be depressed. A child with special needs can be depressed. Okay, I had a child I worked with, and he had ADHD. Okay, he had ADHD, but at the second thoughts and after every evaluation done, it is very possible that that child was also depressed. I don't want to call his name, but he was one child that was very vocal with his outbursts. There is no day, I repeat, there is no day that this child does not have a vocal outburst. There must be something. That thing will be very little. It will just be an instruction. Don't do this or stop this. The next thing you see him shout, jump, and just scream. Other children do not behave as such, definitely. So when you're having things like that happening with a child, it is a cause for concern. Another sign and symptom of childhood depression is social withdrawal. When you see that your child is isolating herself or himself from her friends, from activities, they feel nobody understands them. They feel nobody can take them the way they are, so they withdraw. when your child is withdrawing from friends, withdrawing from activities, not wanting to go to school, not wanting to attend parties, not even wanting to go to the amusement park, there's a problem. There is a serious problem. Another type of childhood depression, another sign, of child, I don't know if I've talked about this, reduced ability to function during events, reduced ability to function during activities, and with people at home, even in the house, it's very possible. Okay, even in the house, the child does not want to function in the house. It's almost the same thing as low energy. The child doesn't want to function in the house. The child doesn't want to function anywhere, even down. It's as bad as even down to the house. It's that bad. So yes, and the last one I'm going to talk about is quite extreme. It's quite extreme. It's very extreme. The child has thoughts of suicide, right? The child has thoughts of suicide. Now, according to research, which searches, girls tend to suffer more from depression than boys, but boys actually follow through, right? They go through with that thought of suicide most of the time. Girls only attempt to do it, but boys actually follow through with it and implement that suicide mission. So another sign or symptom of childhood depression, in general, depression is thoughts of suicide, thoughts of death. You wish you could just go. You wish you could sleep and not wake up. You wish something would just happen, or you just jump off somewhere and just, you don't want anybody to see you anymore. You don't want to be seen. You don't want to be known. You just want to extinguish yourself from life, right? It's a sign of depression in children. Thank you. I hope I've been able to answer.
Oh yeah, I was having a malfunction with my mic. But can you hear me now?
Yes, I can. I can hear you.
Oh yeah. Thank you very much for that answer. It was really explanatory. But you know, when you were talking, you mentioned something that you should be able to ask your children questions. We have a question in the chat box which we're going to address. But before we go to this particular question, I want to ask, what kind of questions do you think a parent, because you know, children, you need to be very careful with them. They might not even understand things at your level. I mean, you can't tell the child that, oh, I think you have depression. What do you think are the causes of it? I mean, a child might not really say that. So what are the kind of questions you think a parent can ask a child that will make that child effectively review what the problem is?
Okay. There are two types of questions. We have open-ended questions and closed-ended questions. So these two types of questions are very important, actually. I wouldn't say that we should only stick to one. They are very important. So a type of question is open-ended questions are questions that you give the child room to explain further, while closed-ended questions are questions you just ask and they give you a yes or no. Yes or no. Okay, they are both important. These types of questions are both important. So types of questions you should ask your child. You can ask your child, do you feel sad? When you notice that, especially when you notice the mood change, don't wait for the child to come out of the mood before you ask them. No. Do you feel sad? It's a very reasonable question to ask your child. And when the child tells you, yes, I feel sad, then you go further to question, what is making you feel sad? Okay? What is making you feel sad? Another type of question you can ask your child is, have you been feeling cranky lately? Have you been feeling cranky lately? The child tells you, yes, most of the time I feel very cranky. I feel very disorganized. I feel this, I feel that. Now you're trying to know how the child feels. These two questions, you're trying to know how the child feels before you go to the child explaining what is making them feel that way. Now you can also ask your child, on number 3 question you can ask your child is, do you know what is bothering you? Do you know what is bothering you? Do you know what is bothering you? So most children don't have any specifics. They don't have any specifics. They won't give you a straightforward answer. While some will give you a straightforward answer. I had this child I worked with, a very challenging, very, very sweet boy I worked with, and to the best of my knowledge, I think he had DMDD. On one occasion in class, I reached out to give this boy a hug. Okay, I reached out to give him a hug after we had a session. Like, I talked to him. He wasn't paying attention in class. He didn't want to do anything. He just wanted to stay. So I had a little session with him, back and forth question. I had to encourage him and all. And at the end, I thought, okay, we're good. And I reached out to hug him. And the next thing, he came at me and tried to be aggressive. There was an outburst, right? There was an outburst. After that day, the boy did not want to come to school. Okay, he did not want to come to school. And if I looked further into that situation and asked how he behaved at home, which I did not know because I was not in the house, it could have been a similar situation. So when you have a child as that and you ask him if he has what is bothering him, definitely something will be bothering him for him to not want to participate in class. He doesn't want to do anything. That's social withdrawal. He doesn't want to do anything. You ask him questions like, do you know what is bothering you? And they're very vocal. They'll tell you. If there's something bothering them, they'll let you know. Another question you can ask your child is, if you want to know how your child is functioning with their peers, right? You can ask your child, who are your friends now? Tell the child, the child will be very interactive. Who are your friends now? How many friends do you have in school? What do you do with your friends? What do you do with them? Do you guys play? Do you guys talk? What do you do with your friends? Or who are your friends? If you want to know how your child relates with others in school, with his or her peers in school. Another question is, this is a very sensitive question. Another question you can ask your child is, do you sometimes wish you weren't alive? Do you sometimes wish you were in another land? You were in another planet? You were in another generation? Do you sometimes wish that? When a child is wishing things like this, especially wishing that they were not alive, there's a problem. You just have to get the answer from them. So when you ask these are not all the questions, but these are some of the questions you should ask your child. What is making you cranky? Do you know do you have something bothering you? Right? Do you feel sad at the moment? Do you always feel cranky? Do you have friends? What do you do with your friends? Do you sometimes wish you weren't alive? And when you're asking these questions and they're giving you answers, it's very important that you don't become judgmental. Because if you have a child that is depressed and the child is very sensitive, the sensitivity of the child has increased, and the child is giving you answers and you're being judgmental, you're being too reactive, the child will withdraw, basically. Because it's already bad enough for the child is being too sensitive, and they see your response after they open up to you, they see your response, they'll withdraw. So it's very important that when these children are giving you this answer, try as much as possible to be neutral. Try as much as possible to understand where they are coming from, so they'll be able to voice out
more. Okay, thank you so much for that. Thank you for that answer. Very quickly, because I'd want us to start rounding off soon. You mentioned MDD at the beginning of this webinar. So there's a question here that, how do we help a child out of
MDD? Excuse me. So I think that question is basically, how can childhood depression be treated, right? So both MDD and DMDD, they are both depressive disorders. How can we treat children with depression? Because the treatment can go for both types of depression. Well, we can join both medical treatments and psychotherapy. A type of psychotherapy we would use to help children with both DMDD and MDD is the CBT. The CBT is the cognitive behavioral treatments. I would like to say something before I go into that. Medically, it's been proven that there are certain drugs that children should take that would help them with their depressive disorders. Also, these drugs, it's important that you know that they have serious side effects. They have serious side effects. Okay? According to the people that did the research, this when children are taking these drugs, I don't think okay, when children are taking these drugs, it could lead, I do not even know why they would, it could lead to suicidal thoughts. So it's a very dicey thing. If you're going to expose your child to that medication, you have to follow through closely, very, very closely with the child and the healthcare practitioner. Another type of treatment you can give your child, like I said earlier, is the CBT. And what does CBT does? What does CBT do rather? Like I said, CBT is cognitive behavioral therapy. CBT targets current problems and focuses on how thoughts, feelings, and behaviors are intertwined in everyday functioning and how changes in one domain can lead to improvement in another domain. Okay? So CBT is a type of psychotherapy intervention for children with, with depression. And here in Terragist, we offer these services. You have to be a trained healthcare practitioner before you are able to give this psychotherapy intervention to a child with depression. Now, I'll give you the general name for these medications. I'm going to say it. It's the selective serotonin reuptake inhibitor. That's the class of drug or medication that the child would have to be exposed to, right, to treat depression. So like I said, and it's very important that we know this, children aren't given medications for depressions yet because the current evidence base is insufficient to make a recommendation regarding pharmacotherapy for children with depression. So in other words, it boils down to the psychotherapy intervention for children. Okay, it boils down to the psychotherapy intervention for children. And for this to be effective, it has to go through 6 to 16 weeks, right? 6 to 16 weeks. Every session has to be very detailed. I don't want to go into so much information. Okay, yeah, that's just it.
Oh yeah, it's wise not to go into so much details. I mean, in this context, right? But like she said, if you think your child needs to go through therapy or needs to, be enlightened with these things, you could just reach us at Theragist. You could send us a DM on Instagram at Theragist, and we'll definitely be there to, even give you a free consultation if that is what you need. And after that, we can now tell you that, okay, what we've gotten from this our conversation, we think your child actually needs therapy, right? So that is something that we can offer. So let me ask the last question for this webinar before we conclude for tonight. And the last question is, you know that they always say, Chinwe, that prevention is better than cure, right? So in this case, is it possible? Is there a way that you can prevent? As parents, we are always very protective of our children. Want to save them from harm, save them from hurt and danger. So do you think there's a way that you can prevent them from having depression in the first place, rather than having to cure it or having to find out if they are going through stuff? Is there a way for you to prevent it? Is there any way?
That is a very, 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 very important question. Okay, I would like to say this. Depression can't be prevented. It cannot be prevented, especially there are certain risk factors that are present. Okay. If in your family, right, you have a history or a background of depression, probably somebody suffered from depression in your family, and you give birth to a child from that lineage, just know that there's a 90% chance that that child will suffer from depression. That's just the way it is. That's the biological factor, the genetic breakdown. There's a possibility that the child will suffer from depression. Now that's for the yes, that's for the no, that depression cannot be prevented. But if we want to say, oh, yeah, we can prevent, as a parent, you are not with your child 24/7. You are not with your child in school. You're not with your child when they're with their peers. You're mostly with your child in the house. So as long as that child is living, as long as there are certain things the child will face when the child goes out that you're not in control of, there's a possibility, there are higher chances or higher possibilities that that child will or might suffer from depression. Okay, but I can also say for a fact that some children get depressed from the house. So in your house, you can control the environment. It's a controlled environment. You try as much as possible not to let the environment your child is growing up in be one that is toxic. You try as much as possible as a parent not to neglect your child, not to expose your child to a dysfunctional home background, a dysfunctional home. When a child is exposed to a dysfunctional home where there's a lot of aggression, there's a lot of violence, there's a lot of maltreatment, there's a lot of neglect, then that child is very prone to being depressed. Do not neglect your child. Always be attentive to your child. Give your child time. Always give your child time. It is very important. Children cannot function correctly, or they cannot function the way they should if they are being neglected as children. A child cannot function properly if you neglect them. Okay? Give your child the attention they need. Control the environment, at least the one you can control, the house you're living in. If you can control that, then there's a possibility that you avoid, you prevent some type of, mood disorders from the child.
Okay, thank you so much. So there you have it, ladies and gentlemen. It's actually funny that our physical health has a way of affecting, our children. Now, understanding that even our mental health also has a way of affecting our children it actually shows that parents have a lot of responsibilities, right? A lot of responsibilities. But yes, this is where we'll be drawing the curtain for today. Thank you so, so much, Miss Chinwe. I was enlightened, and I'm sure that everyone that is watching this or that will watch this got value from this webinar. Thank you so much for that. Like I said earlier, if you have questions, if you need consultations, just send us a DM at Terragist on Instagram. And please, if you're not following this channel yet, this is your sign to subscribe to our YouTube channel. Do that as you're listening to this. Thank you so much, everyone, for joining. Thank you so much for being a part of this. And until we come your way next month, have a very, very fulfilling one. Take care. Bye.